Now, I know we say the government of the day, but the government does seem to be taking that term to new heights. The NHS is top of what I hear about on the doorsteps, Mr Deputy Speaker. How long will it take to see a GP? Will their children get support with complex and little understood conditions such as PANS Panda? Are there specialists available for when support is needed and things go wrong? Or how do they access mental health needs? And strictly speaking, of course, I understand that the day-to-day decisions about NHS Scotland aren't made here, as the running of NHS Scotland is within the devolved competence of the Scottish Parliament. But listening to the Honourable Member for Coatbridge, Christen and Bells Hill earlier, you would think that everything was great in Scotland, and it is right that our spending on the NHS is higher per capita. But it's nothing to do with the generosity of the Scottish Government. We get more money per head to reflect the high cost of delivering services over large rural areas in Scotland. It is simply more expensive to deliver our services. But when I look at North East Fife, we know that our NHS board's finances are stretched beyond the limit. I raised that earlier. And another example is that we no longer have any specialist ME support, because the fact is no one in Scotland now does. But health services, Mr Deputy Speaker, of course include caring services, and my priority for North East Fife is that anyone who needs support to live independently can get it. No one should be left taking up a hospital bed or on a waiting list because of a lack of carers. And a lack of carers has not been addressed by either government. And that is why it's my party's policy to introduce an elevated statutory minimum wage for social care workers, which will instantly help recruitment and place value in this vital profession.